Good afternoon. Welcome to the daily briefing here at St. Clair County EMA, where I'm joined by Chairman Kern and Sam Bierman from the Health Department. And I'm going to start off by saying today I'm not excited about the way things are going today.
I agree. Our numbers are particularly high today. The hope that we had on keeping track on the good numbers that we had earlier in this week has somewhat gone out the window at this point. So as of today, we have done 8,340 tests in St. Clair County with 1,331 positive test results, which is an increase of 32 from yesterday. And that does include both males and females from their teens to their 90s. We are currently at 6,953 negative test results with 56 results still pending. Today we do have some sad news to announce. We will be adding 2 additional deaths to our total, which is now at 101. I had hoped that we would not break the 100 barrier, but we did today. The first was a female in her 90s who did have underlying health conditions, and the second was a male in his 20s with unknown health conditions. And as always, our sympathies go out to their families. For those who have completed their required 14-day IDPH quarantine, we are at 828. And for state totals, 959,175 have been tested, with 123,830 positive test results, which is an increase of 982 from yesterday. For deaths, we are at 5,621 for the state, which is an increase of 96 from yesterday. For hospitalizations, we are at 74 patients that are currently admitted due to COVID-related reasons, and that is the highest number we've had for St. Clair County since April 16th. And currently we have 8 of those patients that are on ventilators. For congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, Brea of Belleville has 40 cases and 4 deaths. Brea of Cahokia has 8 cases and no deaths. Caritas Family Solutions has 11 cases and no deaths. Caseyville Nursing and Rehab has 3 cases and no deaths. Cedarhurst of Shiloh has 11 cases and no deaths. Cedar Ridge of Lebanon has 12 cases and 1 death. Colonnade Senior Living in O'Fallon has 4 cases and no deaths. Four Fountains in Belleville has 104 cases and 24 deaths. Help at Home in Belleville has 2 cases and no deaths. Help at Home in O'Fallon currently has 5 cases and no deaths. Knollwood Retirement Center in Caseyville has 8 cases and 1 death. Lebanon Care Center in Lebanon has 54 cases and 10 deaths. Memorial Care Center in Belleville has 43 cases and 5 deaths. New Athens Home for the Aged has 51 cases and 3 deaths. St. Paul's Home in Belleville has 41 cases and 11 deaths. Swansea Rehab and Care Center has 15 cases and 2 deaths. And finally, TDL Incorporated in Belleville has 4 cases and no deaths. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. So we're going to our zip code report today. Remember, if you don't hear your zip code, it doesn't mean that you don't have a COVID positive person in your zip code. It just means that number has not risen above the level of 5 yet. In 62059, once again, we remain at 7. 62201 went up by 1 to 19. 62203 remains the same at 44. 62204 went up by 1 to 48. 62205 went up by 1 to 50. 62206 remains the same at 113. 62207 remains the same at 80. 62208 went up by 2 today to 81. 62220 remains the same at 143. 62221 remains the same at 111. At 62223 we went up by 1 to 52. In 62226 we remain the same at 145. In 62232 we remain the same at 27. And in 62239 we remain the same at 15. 62243 also is static at 8. 62254 goes up by 6 today to 48. 62257 goes up by 1 to 12. 62258 goes up by 1 to 18. 62260 goes up 2 to 9. 62264 goes up 1 to 41. 62269 is the same at 74. And 62285 remains the same at 14. So you heard Sam talk about our numbers. This is extremely disappointing. As reported today, our hospitalizations are 74 in St. Clair County. We haven't had a number that high since April 15th. So if you think about this, we started doing this around March 15th. March 17th was St. Patrick's Day, so it was right around then. And everything that we did led to the peak, which occurred on April 16th. And now here we are 45 days later, and we're back to that peak again. We have not had hospitalization numbers in St. Clair County this high since April 16th. And I know, Herb, you've got the numbers for the region, and they are equally as disconcerting.
Well, and I want to show this graph. We showed it yesterday. I thought sometimes, a picture's worth 1,000 words, and there was even some comments on our page last night. People appreciated it, but we haven't been this high since April 30th.
In the region.
In the region, and it's alarming. And for those of you who follow the briefings every day, we appreciate that. But I want you to think back, and you can go back and search it. We mentioned before the Memorial Day holiday that we were going to be watching these numbers because we were afraid that people were going to let their guard down. And these numbers are indicating that that was correct. And boy, we wanted to be able to say we're going to be wrong. But you can see where the spike is. And as the chairman said, we don't want to restart this whole process over. And it's all of you. We said this from day one. You have to all buy into this. For those of you who follow these briefings every day and have realized the seriousness of that, we appreciate that wholeheartedly. For those of you who are the doubting Thomases and who think that it's the flu and it's nothing and it's okay for people to die, we had a 20-year-old die in the last 24 hours. When this first started, if you were over 65, 66, I was scared as hell because I fit in that category. But now a 20-year-old. We've had young children down 16 months, Sam, with I think the oldest.
Yes.
So I don't want to hear that about, it only affects the old. It only affects the people in the nursing homes. This is serious stuff. You've heard the chairman sit here and say it. You've heard the health department. You've heard the physicians that came on here. You've heard the hospital administrators. I don't know what else we can tell you. But if you don't start taking this serious, those of you who aren't, Phase 4 is going to be down the road farther than June 26th. And that's what we're all shooting for. So we're going to monitor these. We had Randy Randolph cut another announcement today. It's on the Facebook page. We told you we're watching these numbers hourly, daily, and this is the results we're getting. We've said all along, more testing, we expected some more positive. But our hospitalizations, that's when it's severe. 8 people on vents. Haven't seen 8 people on vents in quite a while. And usually, you've heard it all, usually when these patients get put on vents, it's hard to get them off. So, Chairman, we're doing the best we can do. It's up to our citizens now.
And we're over 100. This was a landmark, as Sam said. This is one that we didn't want to surpass. And it's just, this rise has continued. It has been a slow, steady stream, and now that we start to see a peak again. And this isn't about trying to scare people. I mean, all we try to do here is disseminate the facts and let people use those facts and let them percolate and decide how they're going to react to what we present here. That's why the best way to do this is to follow the guidelines that we've talked about. Wear that mask when you go out. Right now, if you go to the store, you see a limited amount of people that are still wearing masks. I think the sad part is a lot of people feel very emboldened that maybe this is over.
Yeah.
and it's just not. And we want to move into phase 4 at the end of this month. We want, like everybody else, to get back to that stage of normalcy that we're all striving for. But as you said, if we don't make these numbers go down now and not hit this spike, we're going to have problems getting to that June 26th date with the numbers that we need to go into phase 4.
Well, and you said the word there, because we've seen people, as you know, we answer as many of those comments that get put on our briefings every day, and there are people on there says, oh, you're just trying to scare people. Well, maybe that's what people need to be. Maybe they need to be scared. When you hear we're losing 20-year-olds, we're hearing people 90 years old. Yeah, people are in nursing homes, some of them are, but guess what? They may have still been with us if they hadn't contracted the COVID-19. And I don't know why that is so hard to understand. For those of you who have children out there, it's just not the old. For those of you who have the grandparents, the parents out there, if you're not taking it serious, then shame on you. This is serious. Saying we're going to continue to monitor these numbers because we have families, we have co-workers. The chairman walks in here every day with his mask on. We get reports now, we're starting to see, well, I was at so-and-so store and nobody had mask on. Well, don't shop there then. If they're not going to follow what's been recommended to them, that's on them. Be smart about it. Spread the word. Tell your family, tell your friends, tell your neighbors. If you're going to be out there, wear a mask and try to practice that social distancing until we can get this thing under control. So that's all I can tell you today. The numbers aren't looking good. We were hoping we wouldn't have to tell you that, but we're going to tell you that because it's the truth. So we'll see you back here tomorrow. We'll let you know what those numbers are. Cindy and Daisy will be back here in a few moments to translate this into the Spanish community. And please, think about that 20-year-old and think about that 90-year-old patient. We're 101 citizens in St. Clair County. We want Team St. Clair to pull together and let's stop this as best we can, and it's got to be with all of us, not one. Chairman can't do it, all your elected officials can't do it, all of our first responders can't do it. They're out there risking their lives every day. And now it's time we all step up and say we're supporting all of them. We'll see you tomorrow.